Good evening and welcome to the Templeton Board of Health meeting. It is December 17th at 7 p.m. and we will start with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, so I guess we'll start the meeting. We review the minutes from October 28th. Good
They
with
look
me.
fabulous.
Make a motion.
Thank you, Jess.
Yes, thank you, Jess. Earl will make a motion.
Yes, I will.
And I'll second that.
Excellent.
All in favor.
I,
All right, and the communicable disease reporting, Lori?
So we're basically the same as we have been. I don't have any unusual communicable disease reports for you. It's still mostly COVID. The last update was December 12th, and that covered through December 7th. There were 25 molecular tests, and 0 of those were positive. There were no confirmed cases of COVID at this time. And really, that's it for what I have for COVID and any other communicable disease. And we are still out of kits. We're working on that. If we get them, any of the test kits in, we will blast it out there for everybody. Okay.
Thank you. All right, moving on to the landfill and annual inspection report.
As just an overview in your packet, I know I sent you the whole report, but I put Mark Popham's overview, who does our inspections for us, and he does them with monitoring services. And what they found was we are in good shape. We are below levels in 3 of the 5 monitoring wells. 2 of the monitoring wells we're going to need to look at. The groundwater was so high at the time that they couldn't test out of those. So we're taking a look at whether there's any beaver in the area, damming, anything like that. The water levels did not seem that high. I know we had come out of the drought for quite a while there and everything was sopping wet.
Yeah.
But we will look into it and see if there's anything that we can do. I can tell you that this past Thursday, Mary Kushner from Mass DEP and one of her counterparts, they're doing local inspections. They're looking at the landfill caps and things like that. I know that our swale needs to be cleared. I'm working with Bob at the DPW on that, but I'm sure that's going to come back in the report. We had 1 vent that needed to be repaired. That's done. But I'm sure we're going to hear about the swale.
Okay.
With the, I do need signatures for the landfill report so that I can scan that page and send it to Mark to finish the filing. Ugh.
Are you cold?
Yes. I just got the,
I was like that last weekend.
you can sign that one too. That's the minutes.
okay.
17th. I know, I had to look back up at my.
That doesn't work.
Oh, I don't.
That's it.
All right, there you go.
Thank you.
I did read that.
So much fun.
Yeah, I know, right? I was reading it at home going, okay,
Yeah.
I don't know what any of this.
I need a higher
I found an error though.
college document to be able to understand some of the. That's why we have Mark.
Yes.
Yes, he's a good guy. All right, and then move on to the draft solid waste management regulation update.
So right now, they had the special town meeting and they had an excellent turnout. I'd like to petition them to show up every year at annual town meeting.
Yeah.
Um,
I felt bad I couldn't go.
well, it is what it is. So all of the articles that were on the special town meeting passed. All we're waiting for now is the Attorney General's office to do their yay or nay or whatever they normally do. Carol said that can take up sometimes up to a month.
Okay.
But we'll revisit it if only if things don't go well. So I've got the folder, I've got the paperwork. If for some reason it doesn't go, we'll revisit it here and go forward. At least for one.
There's no on-file proposal for anything to go over there anyhow, is there?
No.
Oh, so
No,
It wasn't
we don't have
written?
anything in front of us.
if there was any proposal for anything to be built over there
No.
anyhow, so
Yeah.
it's.
Big
Gotta
for
move
sale
forward.
signs up. So that's good. Thanks, everybody, for everybody who helped with that, so.
Okay, so you're gonna wait for the Attorney General or?
I already gave it to our town council.
Yeah,
But it's kind of on standby because if it passes the Attorney General's office, it's
it's in effect.
good to
Okay.
go.
All right,
So,
got it.
but then you can never predict what they're going to do. So we've had them say no before.
Right, well,
Um,
they make changes too.
they do,
Yeah,
they do. If we have to revisit it, we will.
okay.
Yeah, I sent it on October 29th to town council.
Council?
Yep. Still freezing.
Yes, don't worry.
On my jacket?
Oh
No,
my God, I know.
no, I have a sweater. I could go grab it if I need to. It's mostly my fingers.
Yeah,
Uh-uh,
you're cold.
it's not good.
Hmm.
Any other questions about that, the draft?
I
It's on face?
I don't think so. I
Okay,
think we're pretty good to go.
all right, and number 5. Oh,
John Johnson.
Yes.
John Johnson.
yes, thank you. I saw his face a second ago. Now, you can go back on screen, Johnny Johnson.
I think he muted himself.
Oh.
Something.
Yeah, he is muted right now, I believe. All right, anyways, we're moving along. He's on actually for this one, fluoride, the update. So I did write up, and I think I took it exactly from Pete's Farrell's statement from, I think, 2017, but to have the water department put their public water supply is fluoridated. And they did have this up for a while, according to the Center for Disease Control and Prevention. If your child under the age of 6 months is exclusively consuming infant formula reconstituted with fluoridated water, there may be an increased chance of dental fluorosis. Consult your child's healthcare provider for more information. And we will pass that along to the water company and ask them to put it on the bills and in their information. So, and I know there was other things that had come up with fluoride, and I am going to introduce Dr. Johnny Johnson. He is, I want to give all your credentials right, sir. A pediatric dentist, a diplomat of the Board of Pediatric Dentistry, a life member of American Academy of Pediatric Dentistries, and the current president of the American Fluoridation Society. And he was going to address some of the other concerns or questions that I know, Julie, you had about the studies and the case in California. So ask away if you like.
Well, actually, I was here because I recently found out that the Board of Health in Massachusetts,
Mhm.
our law, well, let me find it again. It does not allow fluoridation to end once begun.
The Board of Health doesn't allow it to end once it's begun.
No. So you can ask the director of the water department to suspend fluoridation if in their professional opinion it poses a risk to consumers. Or you can do a home rule petition, which is what we've done before.
Right.
So you wouldn't even have the authority to
No,
take it out.
Take it
it's always at town meeting.
Right.
It would have to be
Right.
town meeting. And Scott Schwinger was going to be here and he had a personal matter that came up. And he's always willing to listen and to talk. So, and he's the guy at the water department
Oh, okay.
that you want
Yeah,
Scott.
yeah,
to do.
right.
Before we go any further,
Mhm.
Jane, the wording that you have.
Yep.
Can I have that? Because
Yes.
I'll be the one that contacts
Yes.
them tomorrow.
They have that?
You may have that.
It's the
Thank
one
you.
in parentheses.
Thank you.
Tried to cut and paste, but it
Okay.
didn't work. So,
Sorry for the interruption.
okay. So that was your
So-
concern or
Well, that's,
what
I
you
had
found?
just found that
Okay.
out, so we're gonna be going a different angle to do the home rule petition at town meeting.
Okay,
Shooting for May, I assume.
Yeah.
Yeah, okay.
So probably try to approach the Board of Selectmen. I don't know if they'll want to have a hearing or something on it.
I don't know.
I don't know. I don't know.
Sorry.
It's
I
at
can
their
check for you
discretion.
tomorrow, though.
Yeah, that would be good.
all right. So I
Okay.
guess we still support fluoride.
I know you do.
Yeah. And I guess I would ask Dr. Johnson then to give a little bit of information, an update on what's going on with the world of fluoride. And I don't think you're muted anymore.
No, ma'am. Thank you
All
very
right.
much. I appreciate you all allowing me to be here tonight. I am a pediatric dentist. Kind of over the years have been interested in water fluoridation, not only as a pediatric dentist, but also in my county in Florida, Pinellas County, Clearwater, St. Petersburg. 4 out of 7 county commissioners voted it out, not on science, but based on their own personal beliefs. And no harm intended in saying this because one of them was a friend, brought his child to my office. Of course, he said that out in public. I'm not breaking HIPAA rules, but wanted to basically climb the political ladder. 700,000 people got cut off from fluoridation in my county. And this is where I practiced and was raised. Something that moved me to an action, which I have ADHD and anxiety disorder, and this is something I would never even have done in front of 4 or 5 people at a happy hour of dental meeting, let alone speak in front of anyone of a county of 1 million people or even yourselves. But I was so moved by what happened that I got involved, and it took unfortunately a turnover in the county commissioners, 2 getting voted out when they were running for re-election, 2 brought in that ran solely on water fluoridation, bringing it back, and 15 months later we had it back in the water for those over 700,000 people. So I became an accidental spokesperson for fluoridation, something I literally screaming and yelling not to want to do. But this is I became disabled to practice clinically from a bicycle accident in 2009. And the county issue came up in 2011. So I was thrust into a position of something that I did not want to do, but I wanted to give back to my community and my families. And as I got to an older age, which this was a younger age when I had to stop practicing, January 2009, my wrist became fused. So I do it with my mouth now, and I do it for nothing. I do not take a penny, any income or anything to do this. This is my life, my time to give back for my God-given talents to help others. So I use my mouth. The good Lord left my mouth intact. That's just a little bit about me. One thing I have, I thought I heard you were saying that there's going to be a message going into the water bills about using fluoridated water with infant formula would increase, potentially increase. Was there a level of dental fluorosis that was stated there? Or
Do you want that back?
Yes, it does.
Increased dental
Just
fluorosis.
increased dental fluorosis. It's
okay,
just, and we had it on the water bill quite some time ago and they took it off. So we were asked to put that back on. So
is there, if I might, the actual level of dental fluorosis that is potentially increased is mild, and that is per the CDC. And I say that only because there are moderate and severe forms of dental fluorosis, which water fluoridation and even using infant formula, which is what was stated on the CDC's website, it does not lead to anything other than mild, a slight increase, which I will also say, in fact, as a clinician, we see that with being a pediatric dentist for almost 30 years in clinical practice, that those areas of something that you really can't even see looking at people, but we see dental fluorosis that's mild under a bright light when you dry the teeth off and they're really desiccated. Teeth are 5%, enamel's 5% water. Those areas do wear away after about 4 years after the teeth have been in. They're not even noticeable to see them walking down the street to begin with. And we saw that they wore away, and a research paper was printed about 3 years ago now out of the Iowa fluoride study, which documented that indeed was the case. Not as clinicians that we needed to have that documentation, but it's actually, that's what, not to stick my nose into your business, but I just wanted to kind of clarify that not saying what level it is can be taken by those who want to stop fluoridation and saying, oh, you're causing ugly brown pitted staining on teeth, which is a very common thing to say. I thank you for having me tonight. I do have a presentation to go through, and it is kind of an overview, and I do address the court case, the National Toxicology Programs report, and some information from the Cochrane collaboration in England. I will share my slides here.
Aaron, can he share?
Can you share?
Yes.
Okay.
Thank you, Hannah.
Okay, and let me get over to the other screen. Okay, seeing me all right?
Yes, thank you.
And okay, now I will tell you, I come from a state where our state surgeon general, you may probably have heard, recently stated that water fluoridation is public health malpractice. So I apologize a little bit for the title of the slide. It is something that is more intended for here, but it's right, politically put correctly, I would say, put in opinions and politics versus fluoride science. I'd like to first review a bit where fluoride works and what we know about it, how we know that it works. So just to kind of take us quickly down a pathway of how it works, what goes on with it, any potential of safety issues. And then, as I said before, the bottom line is the only thing that we really see from fluoride added at the optimal level of 0.7 parts per million in our water. If it has to be added, 12 million people in the U.S. have optimal fluoride levels in their water naturally. As the water erodes rocks and it comes through the soil to the surface, it picks up fluoride out of those rocks. So let's take a look at what we know about how fluoride works. We know that fluoride gets into the enamel before the teeth come in children when they're developing their permanent teeth. We'll talk about that in a minute, but let's discuss how it gets in and helps the tooth. Our teeth always have bacterial plaque on them. And that is something that we always would say, oh, we don't want to have plaque on our teeth. Well, we've learned that plaque forms rather rapidly within 24 hours. So even myself, considering myself very, very good person at taking care of my teeth, will have plaque on my teeth. Plaque contains bacteria, and the bacteria that lives there eats what we eat, and it uses carbohydrates, not just sugars, but spaghetti, potato chips, anything that can be broken down into sugars, that bacteria will use it. And as a pediatric dentist, we would say the bacteria goes poo-poo on your teeth, and you end up getting a hole in your tooth, a cavity. Well, fluoride, whether it is through water fluoridation as well as in toothpaste or mouth rinses or varnishing, fluoride will actually gets to that plaque and kind of slows down that plaque bacteria from doing its job as well as it would like to. As well, it sandwiches itself between the plaque and the tooth in what's was called a fluoride reservoir. So it's like a bank of fluoride sitting between the plaque and the tooth. What goes on is the plaque, when it produces the acid, tries to go to the tooth surface and it starts to dissolve it, just as you would look at if we ever did the test or the scientific experiment in school when you were younger. You took a egg and you put it in a jar or a beaker with vinegar, and the vinegar, being acetic acid, dissolved the mineral out of the egg shell, and that egg became rubbery. Hopefully the egg was boiled, but it became rubbery. So that's what happens when bacteria produces acid and tries to attack the enamel on the tooth's outer surface. What the fluoride does is, as long as it's not a crucial attack that's been ongoing, it will allow the tooth, as it starts to dissolve, the fluoride drives itself into that enamel when it reforms, and it makes the tooth less likely to be dissolved again. When you have plaque that sits there in a constant bath, there are folks in some areas, we used to, when I was growing up, it was called Surt's mouth. We used to take a mint, if you're old enough to know what a Surt's is. It's like a lifesaver, and you would put it in between your cheek and your tooth and sit there, and you would just allow sugar to be readily available to that plaque, and it would continuously produce acid and dissolve the tooth away. Mountain Dew does the same thing, constantly sipping Mountain Dew. Anything that you drink, soda, whatever that has sugars in it, can be doing the same thing. Well, fluoride helps to drive itself into that enamel, and instead of having would have been developed without fluoride, it's called hydroxyapatite crystals in the enamel. Now we have taken that enamel and put fluoride in it, and it's called fluorapatite, much more resistant to acid attack. But fluoride does get itself into our teeth in one of two ways, and one is through a systemic benefit, that is through water fluoridation. And I have a cutaway of a jaw of a child who's probably about 5 years old. The teeth that are touching together in the middle of the picture are the baby teeth. The ones that are on the cutaway are the permanent teeth that are developing under the gums. While those teeth are developing, fluoridated water, when you drink it, fluoride gets into the enamel that's developing on those permanent teeth, and it actually forms the hydroxyapatite that I was speaking about before, and helps those teeth to develop harder from the inside out before they are ever come into the mouth. Now, this goes on up till age 8 years old that the crowns of those teeth are developing. I will say that it goes on even longer, and more so now we will see people who have jaw sizes that will accommodate wisdom teeth. They will also benefit from fluoride continuously being there while they're developing. Most of us have jaws that are too small and had our wisdom teeth removed. So fluoride works systemically by getting into teeth before they're developing, but also topically through toothpaste, fluoride in toothpaste, fluoride in mouth rinses, fluoride in varnishes that we get in dental offices or school settings, and in water fluoridation by coating our teeth, coating our gums and mouth and tongue. All of our tissues get coated with this fluoride. Plus, remember, we have a bank of fluoride between the teeth and the tooth and that plaque, a bank of fluoride there. So while we're sleeping and all day long, we get a continuous bathing of our teeth of a low amount of fluoride that coats them and helps them prevent cavities if they begin to help remineralize them. It's that low amount of fluoride that we have come to understand that gives us the maximum benefit against cavities. That's why water fluoridation is so vital. Research has really shown us, and Australian researchers have done some of the most outstanding research in the world on this, that without having the fluoride before the teeth come in, there would be no significant prevention of cavities. There would not. So by having fluoridated toothpaste, fluoride in the water, they both act together. One does not replace the other. It's just like airbags, when airbags came out. We didn't stop wearing seat belts. They are additive, complementary. We wear both and we get better protection with both. And the same with systemic and topical fluorides. Both go hand in hand. Okay, let's look at how do we know that water fluoridation is still a key form of prevention? Well, we know that from studies, and this one comes from a study in Calgary, Alberta, Canada. There have been 4 major studies on what happens when we withdraw fluoride from the water. I'll have to say they're exciting studies, but I'll also have to be very frank with you and tell you that it is a very sad situation. I was involved with Calgary in helping them to get fluoridated water returned in 2019. In 2011, they stopped fluoridating the water. Studies showed what ended up happening with the cavity rates skyrocketing, and also the more recent study that just came out, how more and more kids had to be treated, about a 78% rise from 2011 to 2019 when fluoridation stopped in 2011, like it did in my county. Treating kids in the hospital under general anesthesia for taking care of their teeth skyrocketed. When you have young children who are really not yet cooperative, or there's language barriers, or there's physical or mental barriers to treatment, we have to take them to the hospital, put them under general anesthesia. A situation in and of itself, taking a child away from the mother and father's arms and giving it to the anesthesiologist, say, here, put this child to sleep so I can do my work. Take them within an inch of their life, which happens to all of us when we undergo general anesthesia, and then bring them back. Some people don't come back. It's also a very expensive and traumatic experience, like I said, for all of us. I will quickly add to you that water operators prevent more cavities than all of us as dentists do. We also know from studies around the world that fluoridating water prevents 2/3 to 3/4 of children having to go to the hospital to receive treatment for dental care under general anesthesia. So our water operators are unsung heroes, and most of them do not know that. They need to be aware and made the champions that they are. The study that was done in Calgary, Alberta, was one that was very well documented. They had 2 cities. A researcher there, Lindsay McLaren, was studying cavity rates between these 2 different cities. Calgary, which was fluoridated, and Edmonton to its north was fluoridated continuously. Calgary stopped in 2011. Edmonton continued doing it all along. As I alluded to, the general anesthetic changes that occurred during the time that from 2011 to 2019, the general anesthetic cases rose by 78%. Let me tell you, not only were the pediatric dentists crying to the city to please return this. I mean, we cannot watch this continue. Also, the families in the city, there was a outcry and a vote to return water fluoridation. And thank the Lord, it did occur in 2011, and it is ready to get restarted, turn it back on next month. It takes, as you know, with any fluoridation program that goes into place or restarts, it takes a few years to get everything in order. Edmonton's rate, which was continuously fluoridated during that time, only rose by 13%, and there's going to be rises and falls as time goes on. Another community that was looked at was Juneau, Alaska, the capital of Alaska. They stopped fluoridating in, I believe it was 2007, and Anchorage is a comparison city, which it was continuously fluoridated. This one study by Jennifer Myers looked at how the cavities changed during that period of time. Her kids were out on the playgrounds when they moved to Juneau from a fluoridated community. She started seeing kids walking on the playground, running around with blackened teeth, brown, missing teeth. And it kind of strikes you, if you've never been to a community that doesn't have fluoridation, how much difference it is that you're looking at in how the teeth look. Well, what she studied and found through using the readily available data, which is Medicaid data, she found that there was a 47% increase in cost to families or to the Medicaid system, which affects us all in our pockets because we pay for this in that period of time, of 47% increased in cost for taking care of the children, as compared to Anchorage, which underwent a 5% increase. Additionally, this to me was one of the most horrific things that you can point out. Money is important, but when we look at what happens to our kids, we saw there in Juneau that the kids under the age of 7 that were born after fluoridation ended, if we took kids that, say you had 30 kids in a classroom that were 3 years old, these were low-income families the kids were under the age of 7, because again, it was Medicaid data. If you had a classroom of 30 kids at 3 years old before fluoridation and after fluoridation stop, the ones after fluoridation stop would have one additional cavity-related procedure. That means extraction, crown, root canal, on and on. They would have one extra. So this 130-room classroom would have 30 more cavities in it. The next year, those kids would have 60 more than their comparative class. The third year, they'd have 90 more. The exponential way in which this kind of multiplies, as a pediatric dentist and as a parent to me, I'm looking at things of look at how much more it is. Yes, money is a issue, but for the Medicaid system, we fund Medicaid. Our government does. Us, the taxpayers, do. Does that make a difference at 47% increase? Of course it does. But look at teeth missing. Look at teeth that are blackened in the mouth. That to me is a horrific thing that we are still working to get Juneau to restart fluoridation. Let me also quickly say fluoridation has never stopped over science. Never has and never is. It is all politically driven. Our Department of Defense knows that at least half of our Army recruits now are not military ready. They are not deployable because of dental problems. That's why in 2011, the U.S. Department of Defense issued a directive that with every base in the U.S. and around the world will have over 3,300 troops and families will have fluoridated water, because they know that it helps them to have military readiness, deployability, homeland security. And just as an example, if you have a tooth problem, a toothache, and you're in the field, in battlefield, to go in and extract that soldier and take them out of there puts mission in jeopardy, puts those going in to take that person out in jeopardy. That's something that you just can't have. Is it going to happen? Even in the best of situations where your mouth is tuned up? Oh, absolutely. I've had a toothache because a nerve went bad on me under a crown. Those are things that you cannot foresee, but having mouths full of cavities and just roots of teeth because the tops are rotted off, you have to take care of that troop, that soldier, before they are deployable. Now, quickly, and I've kind of said this, so I won't belabor the point, but how does it affect us as families, as taxpayers, and our health costs? Studies have been done, outstanding studies on and on, where it definitely has shown that fluoridating the water saves cost for everyone. Having fluoridated water, and these are in 2013 numbers, these are 11 years old. Those researchers that had done this research project and published it in 2016, I believe it was published, showed that by having fluoridated water in your community, you saved $32.19, $32.19 per person per year, every year, in dental treatment cost. You didn't have to go get that $32 per year in treatment costs. To me, that's a big tax income, big tax hit. If you are saving $32 and going to the dentist, which your dental care is not taxed, and you're able to spend that money in your community is benefiting from the tax dollars on that disposable income. When you look at Medicaid studies, these are just two of several that have been done, many, I should say. Texas found that the Medicaid program saved $24 per child per year when they had fluoridated water in place. A Louisiana study showed that Medicaid saved $36 per child in just a 1-year time frame. So it's a huge savings to our healthcare system and as taxpayers. What concerns have been raised about fluoride safety? And this is where we'll get into the stuff right now. Pardon me. I'm older, have taken lots of medications, and it dries my mouth out. And that is a huge, huge issue for me because with a dry mouth, we have a greatly increased chance of getting cavities, and fluoridated water is one huge benefit to us. And that wasn't a plug, that was actual service. When we feel that we have been wronged, we go to the U.S. courts because if you've done something to me that hurts me and you won't make it right, we can't come to an agreement. Fluoridation has been challenged since 1945 when it first began, 108 times in the U.S. courts, and never has a U.S. court ordered fluoridation to be stopped. Most of these challenges have been over, it's my right, my body, I get to choose what I want to have done. You're making me take a medication, you're force medicating me, you're not giving me the right to do what I want. Well, all of those issues have been heard in the U.S. courts, and all of them have been judged not a reason to stop water fluoridation. In fact, one court said, listen, it is the utility's responsibility to get the water to your faucet. Your choice to use it or not is when you turn that faucet on. If you're going to make Kool-Aid, you're going to make yourself a scotch and soda. If you're going to have a glass of tea or just drink the water, that is your choice when you turn it on. To make a flip side of that, to have a person to have that, this is me saying this now, not the court, but the flip side of that is by a person who doesn't agree with the public policy, they're saying, I want my individual public policy. It deprives everyone in our communities, our democratic society being one that takes care of everyone. It deprives everyone else of their right to have something because you don't want it. And that's not how this country works. We never have. Now, the 109th case was the one that just finished up in the U.S. courts against the EPA, and they have until January, late in January, I believe it is, to appeal their case. We don't know if they're going to appeal, what they're going to do, but there will be something. This court case was brought by opponents to water fluoridation, and the case went on for years. Lots of reasons for it. I mean, courts go slow. But anyhow, one of the main reasons it went on for an additional 2 years is that the judge knew that the National Toxicology Program had a draft monograph that was going to be coming out. So he sat and waited for it to come out, which is fine. He did say after seeing it that he felt that there was an unreasonable risk, but he didn't conclude with any certainty that water fluoridation was harmful. Now, determining things in a court case like this is just reasonable harm is what they have to show, a reasonable risk. It wasn't that there was a causal relationship. Well, the key points about the EPA decision I wanted to really kind of run through was that the National Toxicology Program had asked the National Academy of Science and Engineering Medicine to do a peer review of the report that they were drafting on fluoride. And the National Academy of Science, Engineering, and Medicine, NASEM for short, is the premier group in the country that provides peer review. They are the ones that everyone goes to. Well, they took the first draft and said to the NTP, you have not provided a clear and convincing argument to support your assessment. This is part of the criticisms that they gave. So they sent it back to them. NTP did a little change, essentially nothing, and sent it back to them. And the second review was really a scathing letter, wasn't a full review. And they sent it back with a lot of bolding, which means screaming in caps. And they told NTP, you cannot draw conclusions regarding low fluoride exposures under 1.5 milligrams per liter, parts per million is also called, including typically those associated with drinking water fluoridation. Well, it took a long time for the NTP to get to this point. They actually abandoned any further review with NASEM. They went on to get another group to evaluate him that they picked, and their group said, oh yeah, it's okay. We still don't know who that group is. Long story short, they eventually came out with their review to be looked at, and it has been published. The judge in this case refused, and in the EPA case, relied on that NT report heavily. And over 120 times, he referred to it in making his decision, his opinion on the outcome of his case. But he didn't really pay close attention, and it's not something that is meant to be critical of the judge, but judges are good at interpreting law, but they're not good at interpreting science. The NTP report stated on its third page in the cover sheet, and then the first and second page at the bottom, it stated in bold, I highlighted this one in yellow, but it said this monograph and its addendum do not address where the sole exposure to fluoride added to drinking water in some countries, i.e. 7 parts per million in the US and Canada, is associated with a measurable effect on IQ. However, the judge used the NTP report to make his decision that it posed an unreasonable risk. Those two things don't really go together. Additionally, more than half of the studies that the NTP used were published in low-quality journals that are not even in our National Library of Medicine. They're not indexed in it. Many of the studies that the NTP used relied on a flawed method of fluoride analysis, spot urine samples, which means a single urine sample from pregnant mothers, one in the first trimester, one in the second trimester, and one in the third trimester, to measure an individual's fluoride exposure. Now, they weren't doing studies themselves. None of these studies in Canada, Mexico, and the recent one out of California, none of them have done their own studies. What they have done is they have looked at tissue banks of pregnant mothers' tissues that have been collected as studying mechanisms or for studying exposures to things in our environment that may be harmful. They were never, ever intended to be used for fluoride analysis, yet it's what's called a convenience sample of materials, and these researchers have used them multiple times, and all the studies out there of stating that there's an association between fluoride in drinking water and IQ have relied on this method of using other things that were drawn and trying to pull them out to show something of an IQ issue. Again, the NTP report said it was not designed to evaluate the safety of fluoridated water in and of itself. We have several studies and systematic reviews from around the world. If I wouldn't be sitting here talking to you about IQ and fluoridated water if there was an association so strong that it was a causal effect, that we said there were IQ issues from drinking fluoridated water. My grandchildren would not be drinking fluoridated water. So if anybody is interested in this, it's myself. We are scientists. We study the whole body. When you go sit down in our office, we're not just looking at a hole in your tooth or a problem with your gums. We look at your entire body's health. We go through your whole health, systemic health, before we ever touch you, to know if your body is having any issues, heart issues, kidney, anything whatsoever that we need to take into account when we are taking care of your mouth. We would not be scientists and experts in this, doctors of the head and the mouth, if we did not do this right. Leading health experts looked at the information and these studies, and they continuously do so, and said that, first of all, the judge did not instruct the EPA to ban fluoridation. That's the bottom line. No matter what you hear about in the judge's opinion, it says at 0.7 parts per million, it's an unreasonable risk, on and on. The bottom line, just like in the previous 108 cases, the judge did not say that fluoridation needed to be banned. Multiple organizations immediately came out after this decision and said, look, the literature, the information that you're basing this on does not hold water, pardon the pun. And I will point to the last one, the American Water Works Association. These is a huge group of scientists and water experts that look at water fluoridation and everything else in our water. Is it harmful or is it not? How do we need to regulate it? They, along with the American Academy of Pediatrics, I don't even need to mention anybody else. We give our babies to our pediatricians and say, provide for their care. I would not have a pediatrician if they told me to do something that was out in left field. I would have yanked them out of there. We trust them with our most prized possessions, the most things that are most important to us. They came out and said, these studies and this decision does not change what the overall body of science, the mountain of science shows. Just to give a quick bottom line on it, the EPA court decision, this again, not a knock, but judges are experts at law, not science. He did not conclude that the fluoride levels in tap water are lowering IQs. Basically used the NTP report to give an opinion that fluoride was something of concern. Many of the studies, over half of them, which is a lot, were flawed and relied. They were from less respected journals, not listed in PubMed. And the EPA itself was not given a directive by the judge, except you can't ignore what I had to say. So they're deciding whether they're going to appeal it or not, and most likely they are going to appeal it because it affects more than just fluoride. It will affect other things, including chlorine in our water, if they don't appeal it. We know, again, showing the Calgary example and the Juneau, Alaska, that when we end water fluoridation, there are horrific consequences. And not all research is created equally. A retraction from BMC Oral Health, which is a very prestigious journal that was published back in 2022, excuse me. It was about IQ, fluoride and IQ in school-age kids. And after a few years, really not even 2 years, it was retracted because it was of poor quality. These journals have peer reviewers. They have peer reviewers that may be as few as 2, as many as maybe 4 or 5. But that doesn't mean they're experts in each individual area that they will be reviewing. They're looking for certain things that make a study stand out as being poor or not. Well, this is just an example of one. And here's another one, Lancet, one of the top journals in medicine. It took them 12 years before they retracted the Andrew Wakefield study with vaccines being linked to autism. It just takes time before the information really gets out there. Scientific panels around the world have confirmed fluoride safety in the past and in continuing and ongoing, and a new one just came out this year. I will say that these are ones that are huge reviews. Health Research Board in Ireland, which I'll talk about a little bit coming up. Public Health England is mandated every 4 years to look at fluoridation and all health systems, your stomach, your heart, your intestines, your thyroid, your brain, IQ, bones, every system in your body. It's just not saying, is fluoride good for your teeth or not? They are mandated to look at every single one. In fact, the Health Research Board in Ireland is mandated to look, because Ireland does mandate fluoridation. They are mandated to look at the health effects, not the benefits, at the health effects only of fluoridation and every system in your body. Food Safety Authority of Ireland, National Health and Medical Research Council of Australia, U.S. Public Health Service, Royal Society of New Zealand's a outstanding one. Those folks have done every few years, and I mean the last one in 2024 that they did the systematic review, they knew and included information about the court case, about the NTP program, and the report that came out. They knew about all of it, and they said it up front. These things have all been looked at, and their bottom line is fluoridation does not cause or is not associated with any IQ issues whatsoever. There have been many, as I said, studies. One really recent one that came out last year was a meta-analysis, which is a meta-analysis. I'm not a mathematician. I had to learn what that was along the way. A meta-analysis is where you, and I apologize if you know this already, just to say it's analysis that looks at it's an analysis that looks at tons and tons of other studies that pulls them together and says, okay, what's the bottom line from all these studies? This was a recent high quality meta-analysis that looked at fluoride and IQs. And they looked at those that had fluoride in children of less than 1.5 parts per million and those that had more than 1.5 parts per million. And they found no evidence of a fluoride IQ association below the level of 1.5 parts per million. And we have our water fluoridated at 0.7 parts per million. Now, what does that mean? We have people in this country that have fluoride in our water at 4 parts per million, 10 parts per million, 20 parts per million, because it depends on how much water it runs over rocks and other things that it can leach fluoride out of as it comes to the surface. Now, the EPA has a maximum level of fluoride that can be in water set at 4 parts per million. This was set decades ago. And the way they did this, they looked at levels at which we finally would see some health issue. What they saw was people who had water fluoride levels, and these are in their own wells. This is not something served up in a public water system. At 4 parts per million and above, they found that people who had this level in their drinking water for 60 years developed skeletal fluorosis, which is a bone disease from too much fluoride in your bones. That does not occur below 4 parts per million. So the EPA they don't set fluoride in water levels as for fluoridation. They set levels at which fluoride can present a health issue. And that top level is 4 parts per million. At that level, with the most recent systematic review, and it was looked at in 2006 and again in 2009 and I think in 2013 by the EPA, and they have not changed it, that at 4 parts per million, the only thing that they had definitively seen was severe dental fluorosis. And that's kind of why I was making that clarification early on. Not to jump into your business. I just wanted to bring that out. At 2 parts per million, and the EPA looks at fluoride naturally existing in water at 2 to 4 parts per million. At 2 parts per million, severe dental fluorosis, which was considered the only definitive health effect that they saw at 4 parts per million, it disappears at 2 parts per million. So no longer do you get that severe dental fluorosis. It is gone at 2 parts per million. Now we have fluoride in our water at 0.7 parts per million, which is 1/3 of that. So there are no health effects that have been found definitively tied to fluoridation. When you go back to the NTP monograph, they said at below 1.5 parts per million, there are no IQ health effects associated with water fluoridation, with fluoride in water at that level. 1.5 parts per million. Now that is what the World Health Organization sets as its level for people in other countries around the world. We have it naturally existing in our EPA. Looked at it on our own and said, we're going to set it at 4 parts per million. That may change. It may change if we find that there are other things that are associated with it. But when the NTP set it at 1.5 parts per million, what they set that at was based on not what goes on in this country. It goes on in foreign countries. And it's basically what the World Health Organization used in setting its level of 1.5 parts per million. That is to prevent skeletal fluorosis. Now, skeletal fluorosis is rare in this country, and it is not related to water fluoridation. And again, up to 4 parts per million, it is not related to fluoride in water. The 1.5 parts per million was set based on a study that came out of China, where they looked at how much water are people drinking and at what level can they begin to see bone disease. Well, 1.5 parts per million in the water in China or in India or any of these other countries that have high naturally existing levels of fluoride, they drink 2 to 2.5 times as much water as we do because they don't have climate control. They're outside, they're working in the fields. So when you drink 2 to 2.5 times 1.5 parts per million, you're talking about 3 to almost 4 parts per million of fluoride in the water. At that level, yes, they get bone disease. They can get what's called crippling skeletal fluorosis. We don't get that. This 1.5, and that's the point that is made so often by those who oppose fluoridation. Well, it's so close to what we have in fluoridated water that at 0.7, this is only twice what we have in fluoridated water. How can we feel comfortable? That's not even the point. The point is the 1.5 applies to the studies that the NTP looked at from other countries. And I don't mean to dwell on that, but that's something that is vitally important to understand. A recent paper that was published in 2024, and this is, I'm a lucky person at times. And I, over the last several years, have made friends with people in other countries through conversations and through meetings. The Cochrane collaboration is one that Cochrane oral review that came out recently. They came out with a review in 2015 that the opponents were using the language from that study or the review to stop water fluoridation. And they're using it again to try and stop water fluoridation. And I'll go through what was said in that review. Well, Anne-Marie Glennie and 2 other researchers met with myself, which I feel like a low man on the totem pole. I'm not a researcher, dean of a dental school, but the British Fluoridation Society asked to have a meeting with them after that review came out in 2015 in London. They agreed. We sat for 2 days and discussed what they had put together and what they had said. One of the things that made a big impression to them was for a county like mine in Pinellas County, we have 7 officials over 1 million people making the decision. In England, they would have 400 counselors in a community of 1 million people. It only took 4 to stop fluoridation. They were floored. How many people do you have in a community of 50,000? We may have 5 city council members. They would have 100. So for them to understand the huge impact of what was said in their plain language summary and how the opponents were using it, that light went off and they totally rewrote their plain language summary. Let me shorten this all up. Anne-Marie Glennie and I have remained friends over the years since then. Their reviews that they put out are not reviews that we see done on water fluoridation. They are an old medical protocol that they have to use to update the literature because that's what was used in the year 2000 by another group. So they have to continue to use it. The appropriate way to look at it is under their public health protocol, but they can't do that. So after 2015, Anne-Marie told me, we are on first name basis. Dr. Glennie. Dr. Glennie told me, she said, Johnny, she goes, we know that in the US and other countries that you all use contemporary studies, which look at how much more decay is stopped or not as much decay. You're not doing before and after studies, which is what we have to use there. She said, we're going to include contemporary studies in our it's going to be 2022. It took till 2024, excuse me, for that review to come out. And indeed they did. And I will go into that in a second, but the short of it is they said the reviews that we use and are good reviews show that water fluoridation is effective, nor should it be stopped once it's in place. It is stopping cavities. Another person that I got to meet a couple of years ago was a group that published the studies you may have heard, Catfish and Lotus. That group is Deborah Moore, Michaela Goodwin, and a third, Lucy O'Malley. We met each other in person last year at a National Oral Health Conference and got to have a wonderful conversation. Good people, very, very good people. They came out with a commentary on a paper that was written by Taher and et al. That is, and are you still hearing me okay?
Oh, yeah.
Yeah.
Okay, I just got one of those flash ups from Starlink saying you're you're unstable, Johnny, which everybody knew anyhow before this. They came out with this with the evaluation of what this Taher paper was, because it was a paper that was exactly similar to NTP, and the methods that Taher used to evaluate studies was exactly what NTP used in evaluating studies. Remember, I said half the studies, half of them in NTP were not great quality. And these folks, Anne Marie Glennie and Deborah Moore, wanted to point out in this review that they did is that the human evidence that Taher used overlaps with the NTP's draft. This came out in June of this year, before the final review came out from NTP, that it overlaps in how they were looking at studies versus the Irish government's review, which I showed you. The Irish government, I showed that to you before, that they had done a review in 2022, systematic, that just looked at harms, as well as a group in Canada that's an independent government appointed group that gives reviews called CADA, Canadian Agency for Drugs Technologies and Health. Pull that one out. Remember that one. So they said, the two groups do not agree on how studies are ranked. And the ones that are absolutely correct are the groups like the Irish and Canadian folks. The reviews, how they do this is how we do it, is what they're saying, how they themselves do it. Studies that were considered high quality and low bias of risk by Taher and NTP are considered of low quality and high risk of bias by the Irish and Canadian reviewers, and many, many more around the country. Now, the ones that they were referring specifically to were the studies by Christine Teal and her group, and that started back in 2019. The studies on IQ and infant formula using this. Truly, it's not just something that came up in your conversation, but this is one of the studies that they had. If you use fluoridated water with infant formula, that your babies had a lower IQ. There have been multiple studies using that flawed method of analysis of urine, one spot urine analysis. Many studies that have been done, including the most recent one from California, Madras study, that use a technique and assess the studies as being high quality. Well, the NTP was criticized severely by NASEM for that exact same reason. You're calling these studies high quality and low risk of bias, where other studies that are definitely of high quality and low risk of bias, you're reversing that. And that's why they abandoned NASEM's review. Now, Myrick also is another thing they pointed to. That's the maternal infant research environmental, I can't remember the acronym, but that was the tissue bank that is available in Canada. And it has not been designed. It was not designed to evaluate fluoride. That was not part of it. But yet, this is what this group of researchers did. This is what you will hear people who oppose fluoridation saying: high quality studies funded by NIH, National Institutes of Health, our tax dollars, are showing that there is an association between fluoride levels in our water and IQ. Well, in fact, yes, we did pay for it. Yes, it was outside of the US. And yes, they do show something, but they are not showing. They're not showing an association that they're claiming they're showing. Lastly, about the Cochrane review, what do they say about the benefits of fluoride? The Cochrane review, as I said, there were a group of people. Well, there's a British one, and there's Cochrane collaborations around the world that look at science in all fields and give very strict, high-quality, evidence-based reviews on them. They looked at the benefits of water fluoridation, and they found that compared to years ago, that we don't get as much cavity reductions as we used to, which we know, not a surprise. We used to, when water fluoridation first came out, it was the only source of fluoride that we adjusted that was basically found in 1901 by accident by a dentist that went out to Colorado Springs that saw that people out there had brown stains on their teeth, and they were born there or either moved in as infants. It didn't happen to adults. So this dentist didn't know what it was. It didn't happen that it was figured out for 30 years that the Public Health Service looked at it and said, well, there's something in the water. We don't know what it is. Everything else tests out good. We didn't have a fluoride probe. They found communities that had good looking teeth, very low cavities, again, unheard of, 1901 through 1930s, almost no cavities, but they had good looking teeth. So they knew there was something common. The bottom common denominator was water. 1930, a fluoride probe got invented and they tested it out. They got water from all these locations, and they found in Colorado Springs that there was high levels of 2 to 12 parts per million of fluoride in the water. And in the communities that had good looking teeth and very few cavities was 1 part per million. That's how we got our levels to do the study starting in 1945 to adjust the natural fluoride levels in our water up to 1 part per million in our 4 cities that were being tested against the ones that didn't adjust their fluoride level in the water. And that's over a period of 10 years, we found a 60 to 70% drop in cavities. Now we have fluoride in communities that don't have fluoridation. We have fluoride sources to them, as well as those of us in fluoridated communities, from things that are produced in fluoridated communities: sodas, juices, foods, toothpaste with fluoride. We have other sources, so we don't see as much of a cavity reduction as we used to, but there's at least a 25% reduction by adding water fluoridation on top of all the other sources out there, including toothpaste. And as a clinician, I will tell you it's more like 50%. There's night and day difference. You walked into my office, I could tell you where you were from, whether you had fluoridated water or not, just by looking at your teeth. What these researchers said that opponents are not putting forward is that it is not a good idea to stop water fluoridation. They stated this in an NBC News report. They've stated it elsewhere, that even though their studies that they were looking at that met their strict criteria, which that study from Canada with the general anesthesia and with the huge cavity rises, those did not meet the criteria because they were done not over a 4-year period. Their criteria for the Cochrane review is very, very strict because it's a medical protocol. Does this medicine work or not? It's not a public health intervention protocol. But what they wanted to really do, and this is what Anne Marie Glennie said, Johnny, we're going to put out information in a review that shows what contemporary studies actually have to say. And this, they stated, don't stop it if you got it going. And secondly, contemporary studies show that water fluoridation is beneficial. They did what they said. They promised it. This is considered the top group in the world on giving the best evidence out there. It's the gold standard, and the opponents will call them the gold standard as well, but they will never utter these words to you. I look at both sides of this information. I'm not a genius. I'm called a subject matter expert. I'm a sponge. You can tell me something typically once, and because of my ADHD, I had to remember it. We didn't have drugs when I was growing up that sped us up and made our brains think straight, like Adderall. We had barbiturates. My mom wouldn't give it to me. Who would ever think to give a kid who was hyperactive that no one wanted to be around amphetamines to make them slow down? But that is effective. These are things that I remember. I have sourced out everything in this presentation. It is yours to have. There are many other studies out there, many other things. I will be more than happy to answer any questions that you have. And if I don't have an answer to it, I promise to get it to you ASAP. Let me stop sharing my screen here. Does anybody want to go back to any of the slides before I take it down?
No.
Good.
Okay. Okay, good.
Any questions?
No, thank you for your time.
Thank you.
Yeah, thank you
No
very much.
questions.
Oh, you're welcome. Thank you all for your, pardon?
We just said thank you.
Oh, okay. It must have been my unstable mobilities here again. A little hiccup. Well, thank you all for having me tonight. I appreciate it. And thank you for the wonderful work that you're doing. You're doing God's work to care for people. And to be in a position like yours, I ran for political office once. And it can be a very grueling and unappreciated position that you're in. And I will tell you that I think the world of what you're doing. Thank you for giving back to your community. Have a good evening, y'all.
Thank
Merry
you.
Christmas to you. Thank you very much.
Merry Christmas.
Thank you. Bye-bye.
Is he sending
You
you?
could send that to me. yeah.
Because I think that both sides should be provided and I can put it
Yeah.
online.
Okay.
I
perfect.
still think that we should do the warning.
Maybe add the word mild in there. I'm gonna look, show you where. Would that be acceptable?
You guys want to
Mild.
switch?
No, that's okay.
Are you afraid of being in the middle?
I'm just a courier.
I would be afraid.
Increased chance of mild dental fluorosis. That is what it is. Okay.
All right. Well, thank you.
Thank you, Julie, for coming.
I will talk to the select board office tomorrow and get back to you on that tomorrow.
Okay, yeah.
I don't
It's
know.
not- It's Christmas, I mean, you know.
Well,
It's-
there's not a lot of people around lately.
There are.
I don't think there was anybody here when I got here tonight.
Like-
so.
Go.
More than you know,
Yeah, I do know.
but I will check.
Unfortunately. All right,
I'm not sure it's gonna require a hearing. I think it's probably much the same
okay,
as before, but I'll ask.
all right. Well, we'll find out.
All right. So our next meeting is January 27th, 2025. That sounds
Oh.
crazy. And so maybe we have a motion.
Motion to adjourn.
And it is later than ever.